Dr. Ed Zimmerman, Aesthetic Revolution Las Vegas, your friendly neighborhood TikTok. Coming to you alive at 5. So we're going to be answering some questions, talking about the case of the week, and having a little fun. Getting ready for Alive at 5 next Wednesday. So if you like this format, we've been getting a lot of positive response. Like, listen, subscribe, do all that stuff. Go over to the YouTube. We've done a bunch of videos. We're doing a lot of social media these days because I enjoy teaching and it's kind of fun. And we're getting a lot of positive feedback. So I thrive on positive feedback. So keep that coming. I appreciate it. Let's talk a little bit about our case of the week. We did a cool case last week, got to see him back and follow up this week. And it was a restrained penis. So we've done buried penis before, but this was kind of cool. This is a guy who had a dorsal slit instead of a circumcision when he was very young. But unless you keep that turtleneck pulled back periodically and cleaning it and all that kind of stuff, it can mat down again. And that's exactly what happened, is the tissue had matted down, grabbed a hold of the tip of the penis, that's the glands, and was actually restraining it from achieving a full erection. And he'd been to several other doctors and hadn't gotten satisfaction, so to speak. So when he came to see me, the tissue had been melded and blended there for, well, all of his life, and been able to have relationships and kids and things like that. But Godzilla wasn't able to get past the sleeve that it was in. It was sort of like being in a hoodie with the strings pulled tight, and it was just the very tip sticking out, and it wasn't able to fully, come out. So we were able to, under local anesthesia with a little bit of conscious sedation, use the CO2 laser to very carefully release all those tethers and allow the tip of the penis and the corona around the tip of the penis and the first part of the shaft to come out, trim just a little of that extra skin, and then bring it down the shaft and put it where it needed to be sewn in so that it could look like a circumcised penis. When the penis popped out, it was kind of like Alien popping out of Sigourney Weaver's chest. It was very graphic and happy to be present, shall we say. So it was happy. He's doing well. Everything's reepithelializing nicely. The incision line looks great. His stitches will come out in about a week, give or take. And he's longer than he ever was before. So that's kind of cool, huh? So that's the case of the week. It's a little bit about a restrained penis. It's not something that many people see, but apparently it's fairly common. We're finding out as we go through some of our other social media things. We've also treated buried penis, which is another anomaly where the tip of the penis isn't even visible. That's a whole different story, so we'll save that for another discussion. Okay, and remind me, what was the next thing we were going into as far as circumcisions?
Someone's asking about penis being darker. Why is the skin darker there?
There's a question about why is the skin darker where?
Penis.
Downstairs.
On their penis. Than their other tissue.
Oh, why is the shaft of the penis and the scrotum darker? The skin is thinner there. So there's several things going on. One is it's potentially more pigmented. It can be. There's also some variations where some guys will get vitiligo there, so they'll have some pigment losses, either just because of an autoimmune disease or because they have had trauma in that area and the pigment cells have been wiped away and don't always come back. But also because the skin is thinner there, you see the blood vessels underneath. So you not only have your normal pigmentation, you've got tissue that when an accordion looks darker than when it's stretched, and you've got the vascularity underneath that's showing through. That's a good thing. So yeah, that area is generally darker in guys and gals, and it's just the way we're put together, just the way nipples are darker and other areas, the mucosa in the mouth are darker, and down below is pretty much a mucosal membrane. It's epithelialized, but it shares a lot of histologic similarity with the mucosal membrane, so it's thinner, more vascular, and more pigmented. So those are all good. I think we had a question about measurements that I wanted to talk about. Now, typically, don't take offense at this, But typically across the world, if we look at the norms, the average penis is about 3.6 inches around. And that's about like this. So it's not huge. And if you take a little tape measure or something like that and you measure 3.6 inches and bring it around into a circle, that's the average guy at rest. Now, there are variations between 3, 3.25, up to say 4.5 of inches around at rest. And those are all very normal. There's a bell-shaped curve, if you will. There are guys who are smaller, under 3 inches with an erection. Long is considered a microphallus, but around, we've seen some pretty small diameters too. Sometimes as small as 2.5 inches is pretty small for an adult male, and we're able to add girth. Then lengthwise, similarly, guys are usually about as long or just a little bit longer than they are around in their resting phase. So the average guy is probably 3.5 to 5 inches, real round numbers, long, if he's 3.5 to 4.5 inches around. And then when there is an erection, when that tissue is engorged, the corpora cavernosa and corpora spongiosum become filled with blood and engorged. There's an additional 1/2 inch to 1.5 inches around and long. So, we will typically see guys that if they were, say, 4 inches, will become 5 inches or so around. And if they were 5 inches, they're likely to become 6 inches or even a little bit more longer. Those are very average numbers. And again, this is a bell-shaped curve of response. There's smaller numbers and there's bigger numbers, but those are the averages. Now, what's too big and why do we care? If the phallus is so long that you can reach out and touch someone from across the room, pardon the pun, then it may impact even the tip of the phallus when it is erect, is firm. It's not as firm as the girth around because it's not supposed to be. If the urethra that goes through the corpora spongiosum on the underside of the penis is compressed, then you won't be able to have an external orgasm, an external ejaculation, or pass urine when you have an erection, a significant erection. So that corpora spongiosum that incorporates the vascular space at the tip of the penis is a little bit softer than the corpora cavernosa that travel across the top at 10 and 2 o'clock. When that tip is firm, if it gets at the right angle and starts pounding the tip of the cervix, that can either push the uterus around, push the uterine ligaments around, the fallopian tubes, or pound on the cervix. It's not very comfortable. So, we weren't designed to do that per se. Now, there's always, again, bell-shaped curve of response, a few people who enjoy that, but for the most part, if we can, have a guy who's somewhere generally between 4 and 6 inches long and not too overweight, and their partner is not too cushioned as well, they can have very satisfactory relations because the most nerve endings are around the tip of the penis and the outer third of the Virginia. And so if you can stimulate with girth the outer third of the Virginia, and the outer third of the Virginia is tight enough, redundant enough to have sensation to the tip of the penis, then you can have both members of the couple getting satisfaction during relations. So those are reasonable things. Remember, guys, if you make it too big, it becomes a Christmas ornament. People are going to enjoy looking at it, but they're not going to want to be around it or use it because it's just too big, it's just not comfortable enough. Women have analogous issues because women engorge similarly to the way guys do. If they have enough foreplay and things are connected, the one head controls the other, so to speak. So there's engorgement, sensation, lubrication, all those things that are going on at the same time in an analogous way than men have. Men just have more projection, if you will. So we've talked a little bit about pigment down below. We've talked a little bit about sizes and engorgement and things like that. There were a couple of other questions we had on the list. Remind me what those were.
So one of our YouTube subscribers is asking, he's a 55-year-old male, and he's asking about circumcision and why at that age would it make sense to be circumcised?
Okay, so again, to restate, if people out in video land couldn't hear, we've got a 55-year-old gentleman who subscribes to the station. Thank you very much, by the way. And he's asking about getting a adult circumcision at the tender age of 55. Well, life's not over, dude. 55 is the new 30, right? So lots of reasons to consider. You don't have to be circumcised. We all know that. If the foreskin can easily be pulled back and easily replaced, life is good. But what if you're with a bunch of guys who are circumcised and you want to quote unquote fit in? That might be a consideration. It's certainly a cosmetic consideration, but consideration nonetheless. What if you have a prevalence because of either your constitution or your weight for that foreskin to have moisture, to contain moisture, and you continuously get inflammation or infections of the glands, the tip of the penis, or even tethers where the tip of the penis is glued to the underside of the foreskin so it doesn't retract easily, or when it does, it bleeds. We see that in a number of questions. Those are all good reasons. If you have good hygiene and you're still having issues, or if you have a foreskin that's so tight that it doesn't easily retract or replace phimosis or paraphimosis, you can Google those. Those are all reasonable considerations as to why to have an adult circumcision. And that's a pretty easy procedure. I enjoy doing them because they're artistic as well as everything else. So, you know, you'll pick up more of the discussion on that when you like and subscribe and go to the YouTube. We've got a bunch of discussions about things like that because people have been interested. But, you know, the procedure for doing an adult circumcision is taking digital pictures, doing the measurements, making sure there isn't too much fluff around the base of the penis so that he doesn't turtle, and then making sure that when we remove the foreskin that we leave enough skin intact and don't reconnect it to the shaft so much that it contains the penis, like our case of the week where the penis was restricted. So we want to make sure that there's always a little extra normal non-mucosal skin, and then the reflection of the mucosal skin under the foreskin from the tip of the penis out to the glands has plenty of room to become erect all the way and not be contained and not hurt. And that's all done under local anesthetic with a little bit of conscious sedation. You would think it would be uncomfortable, and yet guys do great with it. And the recovery is easy. You're out of commission for about 4 weeks. So the little stitches either that we take out in the office at about 2 weeks or so, or we use absorbable stitches, you can have those removed at home, but they're basically going to melt over time. We use a series, we close in several layers. So there's absorbable stitches on the underside of the skin where the normal skin, the normal epithelium that slides up and down the shaft is tacked in place so that it doesn't accordion in and it doesn't come down anymore, because we've cut probably between a ½ inch and an inch of redundant foreskin off when we do that procedure. So we get a nice high and tight looking pickle there for you know, all of you out there in pickle land who want that. And he is a little more sensitive initially. That tip that is not normally exposed gets more sensation, so your body will down regulate that gradually until there's less worrisome sensation. Plenty of sensation for having relations, but sometimes it can be tough just to walk down the street if you're getting too much sensation. So, you know, that will be regulated by your body. Some guys get some swelling, and that swelling can last a number of months, even 6 months or so, but most guys settle down within the first month or two, and the new tissue all seals up nicely. It looks like it was done when you were very young, or that you were sort of born that way, although you weren't, and everything goes along fine. Yeah, those are pretty much the interesting things on circumcision. So, what other questions have you got out there?
I want to know the pros and cons of pumping.
Pros and cons of pumping. Well, pros are that a vacuum pump, whether it's an air pump or a water-based pump, is, if it's appropriately fitted, is kind of like taking your pickle to the gym. So, pickles are a use it or lose it kind of deal to an extent. And if they forget how to do an erection or forget how to maximize an erection, both in girth and in length, they get out of practice. A vacuum pump will help remind it what it can do and how it can stay erect for 10 minutes, 5, 10, 15 minutes, something like that. You really don't need to keep a vacuum pump on longer, and it should not hurt. Please, please, please don't put the vacuum up so much that it hurts. Vacuum pumps are like belts or shoes or socks. They're not a one-size-fits-all. So you've got to find a tube and a base that will allow the lubricated shaft to be pulled into the vacuum chamber and make it maximally long and maximally wide. So you may have to have a chamber that's longer or shorter, wider or narrower, depending on your physique. And then ignore the gauge on it, because the gauges are not calibrated. This is not an FDA approved device, but they can be reasonable. The air vacuum pumps, again, you vacuum and you form a vacuum until you get a nice erection, but it shouldn't hurt. Probably going to stay on for 10 minutes, give or take. You may have to reinitiate the vacuum periodically through then, because there's almost always an air leak, even if you manscape a little bit and put some lube at the base of usually a silicone seal that the penis gets pulled through up into the vacuum pump. Many of them are like USB rechargeable. There's no batteries anymore or anything like that. So they're easy to use, they're easy to get through TSA, no muss, no fuss. You can either use them like going to the gym, or you can use them before relations. And if, as with many men from 35 on, you suffer from a little venous leak syndrome, you may want to put a base ring or a erectile ring, or what they used to call a cock ring, around the base of the shaft so that you can maintain the blood flow that's gone into the shaft and keep it there until the sympathetic nervous system overrides everything and an orgasm and ejaculation occurs, and that's an erection killer. So the parasympathetic fills everything up, the sympathetic causes the release and lets everything relax again. And wash, wipe, and start over again. So wash, dry, all that kind of stuff. All right, so
Another one of our YouTube subscribers has asked if the filler for the happiness procedure moves at all.
good question. Does the filler from the happiness procedure move at all? There are 3 categories of fillers that we use in the happiness procedure. So one is a particularly cross-linked hyaluronic gel that lasts closer to a year. There are many hyaluronic gels that are cross-linked in such a way that they last from here to the parking lot, or they last a few months, but you have to put enough in to make a difference. And when you put the gel into that potential space, very carefully, because if you don't put it in, weave the material in carefully and evenly, you get asymmetries and globs and things that don't look good both at rest and erect. So we have, because we've done surgeries there and we understand the anatomy, it's actually, there's a lot more going on between the underside of the skin and the covering of the hydraulics. The tunica albuginea, of which there are 2 layers, some go this way and some go this way, and most people don't appreciate that, but it's kind of fun trivia. Anyway, so when you put that in and you use a highly cross-linked hyaluronic gel that could be reversed if you hated it, but said no guy to me ever did that they should do that. If you don't allow it to set up for a couple of weeks and the penis accordions, as penises do sometimes, then you can have that material go different directions, and it's much harder to get back into place after it has set up and gone where it shouldn't be. So we don't want asymmetries. There's ways we keep that from happening that we do both in the office and that we have you do. Then other fillers are things like a calcium-based microsphere filler that can be used for some gentlemen, particularly if they have a longer, thinner penis and they're always a shower. It's not great for growers, in my opinion. And then there's a long-lasting volumizer that is also a microsphere biostimulator. It's what I've had in my cheeks for the past 8 years. And again, it doesn't move around as much because of the number of microspheres in it compared to ones that have a lot more microspheres, but the microspheres in the long-lasting material get covered or coated by your body, and you form your own collagen and elastin around each of the over 70 billion microspheres that I'll use in a typical procedure. After that sets up and is very carefully allowed to set up where we want it so that you get an even distribution from the base to the distal place that you want the material to stop, so it doesn't bunch up or do anything, then you can take it for a test drive a period of time after that. But that's one of the critical things that we found out a decade ago, and I know there's still injectors out there who will inject a phallus and tell them, take it for a test drive this weekend, and the patient will come back with something that looks like a donut with a popsicle stick sticking up, or a weird shaped mushroom, and it's tough to get back the way it should be. So anyway, what else you got out there?
Pros and cons.
The stretching devices.
Oh yeah.
Stretching devices. Okay, so that goes with pumps, except that the girth and the length that you get either with a pump or a stretching device is a temporary change. After your bone endings have sealed, after you've gone through puberty, I can't make you taller. I can't really make your arms or your legs longer without some major surgical intervention. And you can't make the phallus a lot longer. If you try to lengthen it, it'll become thinner without stretching out the blood vessels and the nerve endings inside of it. So you can gain some length temporarily, either with a vacuum pump or with a gizmo, and it is a gizmo. There's several of them out there that stretch the penis. They grab onto the tip of the penis, they put it in a semi-flexible cage, and they lean up against the pubic bone, and you've got to leave these things on for hours and hours and hours every day. I'm not quite sure how you hide them artfully under your clothing and for them to have much of an effect. Now, other guys will do weights, and they'll find a way to bind to the tip of the penis, and they'll put progressive weights hanging off of it. Again, pretty uncomfortable, can cause some significant issues when you stretch the corpora cavernosa because it can make them non-functional, can cause some sensory issues, can cause some sloughing of tissue. So if the place where the weight or the stretching device attaches towards the tip of the penis is too tight, it can cause an avascular necrosis, and that at that point you've lost the tip of the penis to an elective procedure that didn't get you a lot, so to speak. Another semi-elective procedure that I pretty much frown upon is, but we get a number of guys who ask nonetheless, because the word just hasn't gotten out, is the lysing of the dorsal suspensory ligament. So the dorsal suspensory ligament is a series of really 3 ligaments at the top of the shaft where it runs under the pubic symphysis, the pubic bone. There's also some big blood vessels and nerves that serve the dorsal penile artery, and some nerves and things that go through there. So you run the risk, if you're messing around with those ligaments, of hitting something important. But if you're able to shear or partially shear enough of those ligaments, it changes the angle of the dangle, and the shaft gains maybe a centimeter, occasionally 2, if you really have a lot of fluffy tissue down there. But it changes the angle of the dangle such that when you have relations, the pickle is much more at risk of getting broken, because one of the reasons that we have the shaft bound up against the parallel, if you will, to the body pretty much, is so we're not ripping the pickle off of the body, and we're not putting the erectile components of the hydraulics in a place where they can be bent or broken. If they're broken, it's a surgical emergency. If they're bent and scar tissue forms, that's Peyronie's syndrome, Peyronie's disease. And if you get over a 30-degree curvature with an erection, then it becomes hard to have relations. Up to about 30 degrees, lots of guys have that. We get lots of interest in, well, it's curved. Okay, that's a variation of normal in almost all mammalian species, interestingly enough, so it's not just humans who get that. As long as it's functional, as long as it can go in the right place, you can still procreate and you can still have relations. But if it gets to the point where it's bent because you have scar tissue pulling down on one side, the other side is not injured in the same way, so it's pushing the full length, and now the shaft is warping to one side, at the base, at the tip, in the mid, wherever that is, and you can feel a firm, almost mobile plaque there. That's a good reason to go to your friendly neighborhood urologist and have a collagenase injected in that potentially. If they look at it, they feel it, they ultrasound it, whatever, to relax that and allow it to relax and stretch in interaction with a stretching device, with a vacuum pump, maybe with some of your own high density platelet-rich plasma, to have it heal correctly. So that's another thing that can be done. But PRP alone isn't quite a satisfactory treatment for a curve. Okay? All right.
Okay, we'll take one more from our YouTube subscribers again.
Okay.
This is going to be P shots and O shots. Kind of
Explain
how they can go together.
What they work.
Okay, so
Or how they.
P shots and O shots are proprietary injection of your own high density platelet rich plasma. So what's platelet rich plasma? When you get a cut and you see that yellowish orangish fluid that if it dried would become a scab, that's plasma. And in the plasma are many tiny microscopic organelles and microscopic cells, platelets. They're only 3 to 5 microns, or teeny tiny, and they're able to cross-link and form a scaffolding that allows you to heal. And they call in the white blood cells to take out the deranged tissue. They call in all the kinases and healing factors that allow you to make new blood vessels and new nerves and new everything in that area to heal it. So if I'm doing a facelift or certain surgeries, I may spray your own platelet-rich plasma under the flap in the face or in the body, or doing abdominoplasty or whatever, in order to help it seal and heal. It acts like a little bit of glue, and it acts like a healing, fertilizing material. And so if you take that material and you can concentrate it, you can selectively inject high-density platelet-rich plasma in places where it may do some good. So one of the places that you can put it is you can put it under eyes when eyes start to look dark and sunken. So it's a variation of that that you can use instead of or with fillers. That's another thing. You can put it into the nipple areolar complex to improve sensation after breast augmentation or mastopexy. You can put it down below the belt in a guy. That's called a P shot, because we're putting the material that's 5 to 7 times concentrated what it is in your bloodstream into the corpora cavernosa and corpora spongiosum. You would think it would be uncomfortable, but we use a very strong topical anesthetic and an ice pack, and we're able to sneak a teeny tiny needle into the area we need, inject painlessly, and then allow that material to go from a liquid to sort of a syrupy material, so it stays in place, isn't immediately washed out into your circulation, and it has more of an influence in rebuilding the blood vessels that are part of the hydraulics and in causing new nerve endings to grow in. So for P shots, guys get improved sensation and improved function, erectile function, sometimes very quickly, but more often several weeks out, that can last for months and months and months. For guys who've had prostate issues or injuries or whatever, we may recommend doing a series of those every 4 to 6 weeks, or doing a package where you do them periodically through the year. So it's just like trimming your hair, getting your teeth clean, cutting your nails. You do these things periodically. It's all part of upkeep. And guys like the results of having better erections. P shots do not, I repeat, do not add a great deal of girth. They maximize the girth that you're able to have naturally. There are a bunch of clinicians out there who are trying to sell P shots to improve girth. All they really do is maximize the ability of the hydraulics to get as big and as full as they can be. So it's kind of a fallacy to say that's girth enhancement. It's not a filler, it's not a synthetic implant or anything like that. The flip side of that, because we're an equal opportunity harasser and we do a lot of couples counseling, is women can have that high density platelet-rich plasma isolated from their body. And when we do the isolation, by the way, we take a third to a quarter of a unit of blood. We're taking a large-ish amount of blood. We're spinning it down, separating the red blood cells from the plasma. Now that plasma is double concentrated. Throw away the red blood cells, take the plasma, spin it again, so now it's 4 times concentrated. And in that container, it's a clinical centrifuge, the plasma at the base of that volume is concentrated even more, so 5 to 7 times. So when we're injecting high density platelet-rich plasma, we're injecting, instead of millions of platelets like the test tube kits do, we're injecting billions of platelets. And this is a case where size matters a lot. If you're doing orthopedics, if you're doing sexual, rejuvenative health, the number of platelets and the activators in it matters a lot. So with women, we're able to place this strategically and painlessly along the side of the clitoris. So the clitoris is connected to the crura, and those engorge in a similar fashion to the corpora cavernosa. You're able to put an injection on the upper wall of the vagina in front of the Grafenberg area, so you can get new nerve endings growing in there, so you can have more sensation, and you support the urethra, so it helps with urinary incontinence. So you get improved sensation, improved engorgement, improved lubrication, and you support the urethra all at the same time. That's what an O shot is for women. And you know, for couples, we will put together a package where you can have P's and O's all through the year to keep each other happy. So, all right, so I think I'm getting 2 different things here.
Talk real quick about the PRP kits and the way it's collected, because that's a big thing out there.
Talk about the
They're not all-
PRP kits. Well, I did talk a little bit about the fact that we don't use the test tubes anymore. We actually got a platelet counter where we monitored the platelet count out of the human, and we measured a series of the test tubes with the thixotropic gels. And some providers out there even try to use regular test tubes that are not FDA approved for allowing you to spin blood down and put it back in a human. They're only meant to go to the laboratory. Because so many of the thixotropic gel test tubes had issues and didn't sufficiently raise the number of platelets to the level we needed to be clinically significant, we did our research and found a clinical centrifuge where the tubes are not spun this way. With centrifugation, the tubes go, the cuvettes go all the way out horizontal, and it really separates the red blood cells from the plasma much more effectively. And then we take that, throw away the red blood cells, spin the PRP, it's now platelet-rich plasma, but that's what the test tubes get on their best day. Now we're gonna spin it again, and we're gonna double concentrate that, and then we're gonna use only the bottom. So our concentrations of platelet-rich plasma are 5 to 7 times physiologic, which is enough to make a big difference when you're putting it in below the belt, or into a joint, or under the eye, or any of the other places, because we do a lot of regenerative medicine here. So that's kind of fun. So that's a good question, and it's something you should know about when you do your shopping as far as where to get your PRP. So if you have questions, send those in. You know, each week we try to answer some of the questions from before. You can call, you can text, you can subscribe, you can look at YouTube. You can call the office, 702-360-6686, and leave a message, okay? Our social media team will eagerly jump upon it and rank. The more messages we get on the more questions, they rank those so that we can talk about them the following week. So, see you next week at our Live at 5. Dr. Ed Zimmerman, Aesthetic Revolution Las Vegas, signing off.